एम 2 टेक्नीशियन के लिए जे MCQ बहुत ही इंपॉर्टेंट है। जे MCQ एक्सरसाइज के लिए है, इसके सारे आंसर आपको वीडियो के एंड या डिस्क्रिप्शन में मिल जाएंगे। चलो हम स्टार्ट करते हैं। विच ऑफ द फॉलोइंग कंडीशन इज characterized by inflammation of the liver? नेफ्राइटिस, हेपेटाइटिस, गैस्ट्रिस, निमोनिया। सो इसका आंसर आप कमेंट बॉक्स में कमेंट कीजिए। सो नेक्स्ट क्वेश्चन इज which of the following types of anesthesia involves injecting an anesthetic near a specific nerve to block pain sensation? General anesthesia, local anesthesia, regional anesthesia, inhalation anesthesia. A patient has bluish discoloration of the skin and lips due to low oxygen level. This condition is known as cyanosis, jaundice, hypotension, bradycardia. Next question is which type of suture material is commonly used for closing deep wounds? Silk, catgut, nylon, cotton. Next question is during CPR, what is the recommended compression to ventilation ratio for an adult? 50:1, 30:2, 10:2, 5:1. Which of the following condition is a potential complication of prolonged immobility? Hypertension, deep vein thrombosis, hypoglycemia, hyperkalemia. Which of the following component of the blood is responsible for carrying oxygen? White blood cells, platelets, hemoglobin, plasma. So next question is Goodell's airway is used to deliver oxygen to lungs, clear the airway of secretion, maintain an open airway in an unconscious patient, measure oxygen saturation in the blood. So next question is the function of the parathyroid hormone is to regulate calcium level in the blood, control blood pressure, stimulate red blood cell production, regulate insulin secretion. Which of the following is the best method to prevent surgical site infections? Frequent dressing change, use to antiseptic hand wash, proper sterilization of instruments, administration of antibiotic post-operatively. So next question is which of the following is not a part of the central nervous system? Brain, spinal cord, peripheral nerves, cerebellum. The first step in controlling bleeding in an emergency is applying antiseptic solution, directly applying film pressure on the wound, cleaning the wound with saline, elevating the injured limb. So next question is which of the following organ is responsible for filtering blood and producing urine? Option A liver, kidney, pancreas, stomach. Next question is which of the following is a common complication after spinal anesthesia? High blood pressure, post-dural puncture, headache, respiratory failure, excessive bleeding. What is the normal range of a healthy adult respiratory rate? 8 to 12, 12 to 20, 20 to 30, 30 to 40 breaths per minute. Which of the following is not a function of the spleen? Filtration of old red blood cell, production of white blood cell, storage of iron, regulation of blood sugar. During a medical emergency, the preferred site for intramuscular injection in an adult is the biceps, bustus, lateralis, deltoid, trapezius. Which of the following statement about spinal anesthesia is true? It is injected into the epidural space to block pain. It is commonly used for lower limb surgeries. So option A 1 and 2 both, only 2, only 1, neither 1. A deficiency of dash can lead to rickets in children and osteomalacia in adult. Vitamin C, vitamin D, vitamin K, vitamin B12. Dash is responsible for transmitting oxygen in the blood, plasma, white blood cells, hemoglobin, platelet. Which of the following surgical procedure is used for the removal of appendix? cholecystectomy, nephrectomy, appendectomy, gastrectomy.